my philosophy of physical therapy is a lot different than most physical therapists, where it's like you get injured, you go into physical therapy, you get rehabbed, you're seen 10 to 12 visits, and you're discharged and you go home. My philosophy in regards to this is that our job is really to increase that human connection through health and wellness. We are here to elevate you to your peak performance.
All right. Well, welcome back to another Rest, Eat, Move podcast. It's Matt, and I have a special guest, which I don't do that very often. And Jill Marlin, who's been on the podcast, this will be your third time, but the first time with me.
Yeah.
So this is going to be fun, and you get to tell us if you might add interviewing you or myself. But as we kind of pump you up and create the introduction, and I think sometimes introductions are too formal, but to me, what stood out is kind of the expert in this, PT space. You have a master's degree in physical therapy. Specifically, it sounds like with orthopedic manual therapy and physical therapy. And you own 4 peak performance physical therapy clinics. But my claim to fame, and you see the bag behind me, Ryan Brem, I sent Ryan to see you for an injury he had. And I asked him later that year, what was the most success of his year? And he said, going to see Jill. So that's kind of to pump you up. That's a pretty incredible thing on a guy playing on the PGA Tour, that his therapy and rehab was his highlight of his year. So thanks for joining me today. You fractured your ankle playing basketball, and that's what got you into this space. But just give the listeners a little bit of a reminder of what you're doing right now and really what got you into physical therapy.
Yeah, for sure. Well, thanks for having me on. It's great to be here and to be talking with you. And always. And new studio. I love it. It's amazing. And whether it's you or your dad, I love what you guys are doing about health and wellness and the passion that you have behind it. So anytime that we get to collaborate and to have the conversation, let's make it happen, because the message can't be heard enough. And so I'm really passionate about that. So when I look at, what brought me into physical therapy, I started as wanting to be go into veterinary medicine.
Oh, really?
And so I spent a lot of time at the MSU veterinary medicine clinic doing surgeries on cow's stomach and, those kind of things, and was just really fascinated about that. But I went through college on a full ride basketball scholarship and fractured my ankle, and the impact of, when something like that happens, you think, I've worked so hard to get here. Am I going to be able to stay in the sport that I love and continue to play that was paying for my college? And, this was 100 years ago. So at that time, it was kind of like, if you're injured, you're out and you might not get your scholarship. Now things have changed and different.
Sure.
So I worked with a therapist all summer long and was able to get back, maintain my full ride scholarship, was able to start and became a pretty significant impact of the team from that point on, and it almost catapulted my career.
Were you a significant impact before the injury?
I was starting on the team. From that, I came back with just a different mindset, a different mentality.
Yeah.
I was, at that point, I was then, in the gym more. I was more intense.
Were you physically back to 100%, or was the mental game what?
I did, yeah. So I got back physically 100%, like that, like that. And so for me, it was that I can overcome. I'd been injured before, but not a lot. I had just dislocated my jaw, but to actually have that kind of injury where I'm like, ooh, this was a bad.
You were playing with some tough people if you got all these injuries. I played basketball, didn't have nearly.
Yeah.
So was the fractured ankle in a game?
It was actually in a game.
Oh.
Yep, was going up for a layup and towards the end of the season. But so that rehab changed me from a mindset of I can really overcome from some pretty significant things, and not only overcome, but come out stronger. So I went on, from there, and then I was like, this is what I want to do. I want to be able to impact and change people's lives, like you talked about with Ryan, somebody that is playing at the highest level that had been through many different systems that weren't helping him.
That were supposedly, the best of the best, right?
Right, yeah. And so looking at that of how do you impact somebody's life so much that they can go back and be better than they ever thought they could?
Well, that will get to, I have a question later on that kind of talks about that, from the idea of just therapy to like prevention and like
Yeah.
performance. That's the name of your company, but optimization. And, that makes a lot of sense for, I see Josh and Mason and I'm going there not because I have an injury necessarily, but because I feel like there's an opportunity to get better.
Yeah.
And I learned this from you guys, not necessarily because you told me, but through the experience that you provide, that sometimes we don't even know what we have the opportunity to do. And in your case, it required maybe an injury to see, wow, there's another level. And then you have, I'm sure, majority of your clients are not athletes or peak.
Right. Yeah. Yeah. I mean, we see all ranges we have pediatric specialists to women's health to professional athletes that we see. And so, any kind of body can get better, and you guys do that a ton with nutrition. You start where you stand and you get better from there. And
Sure.
so a lot of times people think, well, I'm not ready for physical therapy. Well, we always say, like, when are you ever going to be? Like, that's the time that you need to start.
Right.
Like you start where you stand and you get better from there.
Well, that's one of my big questions in your opinion. And if we're talking about like visionary, not necessarily where you are, but I think you're pretty close to your vision, like who's physical therapy for?
Yeah. So really it's for anybody. So individuals that are looking, like in our instance, so traditional medicine, and I know you have talked about this, my philosophy of physical therapy is a lot different than most physical therapists, where it's like you get injured, you go into physical therapy, you get rehabbed, you're seen 10 to 12 visits, and you're discharged and you go home. My philosophy in regards to this is that our job is really to increase that human connection through health and wellness. We are here to elevate you to your peak performance, not just see you when you're injured. We're here to see you before you're injured, if you get injured, after you get injured, and then optimize your performance by touch points throughout the year. Because why wait till you're hurt? It takes so much more time, effort, and energy when you're hurt to get back. If you can do little touch points throughout the year to stay healthy, that's where the best people perform.
Well, that's kind of where I'm at as I've gone through your experience, and it's like the wealth of knowledge of someone like yourself or Josh, and those are the only two in your system, but I'm sure everybody.
Yeah.
And you're like, wow, they have this wealth of knowledge. In my case, I didn't get injured to a point where like I couldn't walk.
Right, yeah.
And one of the things that you helped me through is just the system in general of how do you get into physical therapy? I guess a question is how involved, and you've done a lot to advocate for this, insurance, cash, as you paint this picture for what's possible. Like if this is for, you said anybody, but it sounds like for everybody. Mm-hmm. So not just, I kind of look at anybody like anybody could qualify, but I think everybody could benefit.
Right, yeah.
And so like insurance is kind of the driver still, would you say, for physical therapy?
I would say that it is because that's the system that people understand how they get to physical therapy. But that's not the system that's of where it is right now. So there's a thing called direct access where you can walk into a physical therapy place and get treated by a physical therapist in the state of Michigan. And so I chaired the state board of physical therapy, and I assisted in passing what's called direct access several years ago. And that's where people can walk in like you would walk into your primary care physician or a chiropractor or a massage therapist.
Or personal trainer, yeah.
Right. Or come in to see you guys.
Yeah.
That's what direct access. You can do that with physical therapy right now. The
But
difference
you couldn't do that in the past?
You couldn't, no. So that was about 8 years ago that passed. Michigan was the last state in the country that passed that. Every other state in the country had that ability. Many of our states currently, so we have that ability right now, but it's limited to 10 visits in 21 days. So there is a Senate bill right now, 144, that's sitting in that went through House and Senate, but kind of dwindled at the end of the year. It's now being reintroduced in health policy to have physical therapy be the musculoskeletal experts where you can come into physical therapy without a prescription. And that's because right now the access of care is atrocious. Like we do not have enough primary care physicians to be able to get in, whether it's pediatrics, whether it's primary care, And so people cannot get in to see primary care. And when they do get in to see primary care, they oftentimes don't have the specialty in musculoskeletal to understand where to go or how to do. So then what happens is they refer for a test or a measure, an MRI and X-ray, and then it's another 2 months, and then another 2 months. And then we find people getting stuck in the system.
Yeah, I mean, that's so how obviously, my dad has just loved going to see you, and my mom's going to see you, and he sent many different people to go to see you.
Yeah.
And I was running through COVID trying to break a 5-minute mile, which I didn't accomplish. I kind of tweaked my calf. But long story short, it was really not my calf. It was my hamstring and my back and all the connection of the whole body, and including the mind. You know, there's some mental components to it. But when I came, he said, you need to go see Jill. And I said, well, I've been seeing a physical therapist, and I went to Dr. Norris, and I don't have any real injury.
Yeah.
You know, on a scale 1 to 10, I'm a 0 of pain until I want to peak perform. You know, what do you do?
Yeah.
And you said, well, you need a prescription. But you kind of helped me get into that system, which most people aren't going to have a Jill Marlin at their disposal to help them through the system. So,
Right, yeah.
so in 8 years, it sounds like it's gotten better. But how much better does it need to get for the average Joe to realize that they can navigate?
It needs to get a lot better. And how it gets better is by education of the community. Because I guess if like somebody in the community or any kind of patients that are coming in, what they demand will get better. And it can't just be one person or the other person, but you know, the economy of scale.
Yeah.
If a lot of people are saying, like, we are not able to get in to get care, something needs to be changed, eventually things start to happen and things start to get changed and start to get better because they're demanding that from the economy. You know, they're demanding that from the small
It's like food.
businesses.
If you want the food to get better, stop buying the bad food, right?
Right.
And we've seen
Yeah.
that happen over the years as processed organic food is more readily available because the demand goes there. Same thing with care.
Ease of access. Look at ease of access with food.
Yeah.
And look at the quality of food that's ease of access right now.
Yeah.
Like if you
It's
can
much
drive, any
different.
drive-through that you can drive through right now is not tremendously healthy for you, right? Like, and so, but if you make it easy, that's where you're gonna go. So our job in healthcare is to make it easy to get the best possible care.
I could go a bunch of different directions. This gets me really charged up because I think there's a huge opportunity. Obviously, we talk about it a lot. We can't say this enough. We can't meet enough people, work with enough people.
Right.
And so I feel like we're just at the tip of the iceberg to help people. When I come to see peak performance or just physical therapy in general, if I'm going down the insurance path, are you more limited than if I came down in the direct access and just paid cash and what you can do?
Yeah, so it depends on the insurance, which is really interesting. So when I'm talking about direct access, there's two different things. There's the Practice Act in the state of Michigan, which determines how physical therapists need to practice based on their license, or medical practitioners or chiropractors. Anybody that's licensed in the state of Michigan has a Practice Act that they have to follow to keep their license and to renew their license. So whether it's continuing education or the rules by which they have to follow. And then there's insurance guidelines. And those are two separate things. So our Practice Act in physical therapy says you can walk into any physical therapist in the state and get physical therapy. But if you want to use your insurance now, you have to follow their guidelines because they have rules by which you have to follow their guidelines. And often that's where they're more restrictive. So they may say, okay, you need to have, before you have surgery, you need to go to physical therapy first, or you may need to have an MRI, or you have to have a prescription, or if we're going to pay for it. So those are the things that as a consumer, it's very important to know the difference. Like, what is your rights? And then what are your insurance rights? And if you come in and pay privately, you then don't have to follow your insurance rules and regulations. So there's opportunities to be able to negotiate pricing and be more flexible in scheduling.
How about more time? Is that an option?
Definitely. Yeah, definitely.
Because is the insurance guideline telling you time?
The insurance won't tell you time, but they will tell you how many visits they'll cover with anything, or they'll tell, like even with your primary care, they'll tell you how much they'll cover. So for Medicare, they'll say, we'll cover 1 physical a year. So if you wanted to be on supplementations, and you're like, hey, I need my blood work regulated, like I want to test this on a regular to see how these supplements, your insurance will say, we won't cover that. So then you say, I'm going to cover it privately. Right. And so the demands then start coming in. So you can be more creative when you're a private pay patient.
Yeah, we're kind of going through this as a family. We're looking at potentially some insurance options, and it frustrates me at the price that I'm going to pay for what I'm going to get. And that's a whole nother conversation.
Yeah.
I guess in my perspective, in my bubble of what I think is possible, I just love the cash pay concept for services in the past, like physical therapy or doctor visits or those types of licensed, regulated things that I can just go control myself. I don't know how close that will ever be, but that's kind of, to me, the exciting part. Like, I wrote down, my vision for physical therapy is like the same as my vision for personal trainers. It's like the sense of, I think a personal trainer can add more value than the past. And I think a physical therapist is going to be the quarterback for many people for their prevention in the future. But it's
in their musculoskeletal care, for sure.
Yeah. And the prevention piece, because I think if you ask someone on the side of the road or walking down the street, do you need physical therapy? I think they think, well, I don't have an injury.
Right, yeah.
I think majority of people still think that. As I've gone through your system and what I'm advocating for everyone listening is, I think physical therapy is one of your most powerful preventative things, because we all have musculoskeletal issues that we may not even be aware of.
Right, yeah.
That could prevent us from an injury, but more importantly, enhance the quality of our life. I know my tendencies. I've known them before, but to actually have an expert adjust it, manipulate it, create therapies for it, or movement patterns, that's powerful. Or cupping or dry needling, and these are things to me that are only going to get more powerful.
Yeah, and there's a tremendous amount of modalities that oftentimes when you say like access of physical therapy, again, people think they need to be injured to come in. And everybody wants the results of a professional athlete. They'll say, they got back on the field in 2 weeks, why can't I? Yeah. And it's because they are getting physical therapy every day. They are getting massage therapy. Like, their body is their job. And so they're treating it like their job. And what's their pain tolerance
and what's their effort outside of that window?
Yeah, and what are their motivators? Because we know that motivators increase modulation, right? Like, those are all things that we look at. And so, when I look at that, individuals that can come in early, that can really get those treatments or get looked at, because our bodies are tremendous in healing. Tremendous. They are going to do whatever they can to keep us going.
Sure.
And keep the pain away, to keep the pain at bay. So what's going to happen is that people say, well, I've done that my whole life and I was never in pain. I don't know why it hurt now. Well, it's kind of like that cigarette that you smoke, right? Yeah. You don't die the day you smoke your first cigarette.
Sure.
But we all know that it's extremely unhealthy, right? That can lead to death. And because your body's working so hard to keep you going, people don't even realize that they're going down the wrong path, because your body's working hard just to keep you on the straight and narrow. What they don't realize is how much better they can feel. There is a void between that, and that's where we come in.
Yeah, you're preaching to a choir, and I think I just advocate for it so much, because the average person that listens to us might think, Matt, you must feel real good. Well, there's some days that I tweak my back or have
everybody has
ankle
the
tightness,
issues.
And then you go and you have these great experiences, because part of it is an experience. So we've all gone to people that have the knowledge, but the actually experience of care is a whole different thing. And I think you blend most those things as well as I've seen, and I think it will only get better. But the insurance healthcare system, it is frustrating, and I think you guys are, it sounds like, right at the cusp of it, especially in the involvement of your direct access. But you said something earlier, and I think we need to do a little bit of rewinding. You said the connection between the musculoskeletal system and the brain, and how your motivation or your hope has an impact on your healing and your recovery. what you mean by that, and like what do people need to kind of hear that connection? Like if I go and I just go through the motion, am I going to recover the same way as if someone's going in there with intent and hope and optimism?
Yeah, so there, I've been in this field long enough to know, and, I'm crazy about digging into the science, but there is a definite art to individuals getting better. And understanding that and knowing that is crucial. And that's something that I work really, really hard with my team. And because I've dug in and I just want to know, I'm extremely curious. So I'm very keen on the healing process of every tissue in your body, right? So when I look at like, when should your skin heal? When should a muscle heal? How should it heal? How do you put it, how do ligaments and tendons and bones and, what are their time frames? When you see somebody that is not healing in those time frames, that their pain continues, you have to get curious about it. It can't just be, oh, they just have a broken body. Like, that's not it. Your bodies are phenomenal in healing, like we talked about earlier. And obviously the nutrition that you put in is part of it. But the mind-body connection is tremendous. So I started going down the neuro pain science education loophole and how to make people optimal, their optimal wellness, their peak performance, better than they ever can imagine that they could be. And so how you do that is you have to tap into the brain, because oftentimes we will have people that are lingering in their pain responses well beyond their tissue healing capabilities. Their tissues are healed, but they're still in pain. Their structure is normal, but they're still in pain. And so what I found is that through neural pain science education, that's where miracles happen. And tapping into the way that so understanding the modulation of pain in your body, you don't have pain receptors in your body. You have pressure and temperature receptors in your body. So your C fibers, your big C fibers, your A delta, your B beta fibers, like they tell you pressure or temperature. How you determine if that's painful or not is where it's processed in your brain.
Really?
It's either processed in your prefrontal cortex, which is the newer part of your brain, which is the part of your brain that's the smart and logical part of your brain. And when you start to get a lot of signals in there, you have what are called interneurons that are your soldiers. Like today, as you sit right now, you're not thinking about the socks on your feet, right? But if you put socks on babies' feet, right, when you put socks on babies' feet, all they can think about is how you get them off.
Sure.
They're pulling at them all the time, right? They haven't developed those interneurons that's safe.
Yeah.
Once you develop that it's safe, your body is constantly trying to get the pain and injury and any kind of danger away, right? So those interneurons move those out. Your brain in that prefrontal cortex is very logical. When you start to wear down those interneurons, you start processing in your limbic lobe, which is the oldest part of your brain, which is emotion and instinct. And so we will have people that will come in that have been in pain so long that now their pain becomes emotional and instinctual. When I do this, that hurts, because it's always hurt, even when they're better and their tissues are healed. So part of the training that we do with our staff is connecting that the way that we're processing the feedback in your brain. And I've done this with patient after patient after patient, and they will come in and say, I have been 9, 10, 15, 20 other providers, and everybody tells me they can't heal me. And so I look at them and I'm like,
their structure's normal.
Their structure's normal. Now, and they may have had a herniated disc.
Sure.
12 months ago, 6 months ago, but they're healed.
But how many people do you see where their structure is not normal? They don't have the pain, right? It goes both ways.
Right, it goes both ways. Yeah,
and in your case,
absolutely.
you fracture your ankle, and I'm sure but you can overcome some of that. And
yeah. And so how much of those tests, when somebody goes in and gets an MRI, and they come back and they say, yeah, I mean, they read that MRI, and that looks scary. It's 5 paragraphs long about how they have a posterior lateral disc protrusion and a herniated this and arthritis here and this, like, whoa, like I'm going to die. That's what people think,
yeah.
Right? But when they come in to see us, we can say, you've had all this for years.
Sure.
It's not causing your symptoms. When I can evaluate them and provocate and alleviate where their symptoms are coming from, I can say, you know what? This is what your MRI says. this is where your pain is coming from. And 3 weeks ago, you didn't have it. This stuff doesn't change in 3 weeks. This is something that takes 20 years to happen.
So it's almost like the habit of pain. You get into this habit and then it wears down in that prefrontal cortex and goes into
and then you start processing it emotionally. And
that's what I
when
wrote
it
down,
starts,
emotionally.
Yeah, when it goes to your limbic lobe doesn't know how to be logical. It doesn't know how to, that's not the part of the brain, that's your logical part of the brain. So how you
so
get
your
it,
identity becomes kind of this pain in a sense that
Yeah.
you've always, you go for a run, I can't run because it hurts.
that, yes, like that term, and how you hear people talk about their symptoms is how you know where they're processing. So like, oh man, I would love to do that, but that's a little scary. I'm afraid I might get hurt. Like they'll start talking in emotions as opposed to logic about their pain.
Have you ever read Biology of Belief?
Yeah.
You have?
Yes.
Yeah, and it doesn't connect 100%, but the concept does.
A little bit.
The big picture of we're much more than just our cells and our tissue and our structures and, is my hamstring pulled? It's like there's a belief piece that is, like you said, it's not necessarily always the science or can you point to it?
Yeah.
Why does somebody, why does someone get cured of stage 4 cancer that no one's ever seen before? There's something maybe beyond just the science and the medical
Right.
piece
Yeah.
of it. There's a hope, there's optimism, but I always thought that biology of belief and what I'm hearing you say is like it's our emotional behavior. It's the way that we're thinking about it. It's what we're telling ourselves. If we tell ourselves we'll never be able to run again because this, you've already answered your question.
Right.
And then as you see this a lot, even though you're trying to help, people's range and capacity diminishes as they get older or an injury sidetracked them and to both of us, we believe the biology of belief, like everybody can kind of heal.
The body's tremendous if you put it in the right environment to heal. And I think that's exactly like what you were saying. It's like that belief is really empowering. And there's tons of, it's scientific too. Like it's not just like,
you did a beautiful job of doing that.
You don't believe it or you don't, there is tremendous amount of research coming out of Stanford and Harvard. Aaliyah Crum is somebody that's done a ton of work with that.
Dug deep for all of us to kind of connect that dot. How many people are practicing this way in physical therapy? I mean, I know you go to conferences and I'm sure there's great providers and some that you think could do better, but
yeah, I think it's something that's emerging in our profession. People are looking at that and how people are tying it all together, hopefully more and more. That's why talking about it and getting the message out, because once you know the science of healing, and if it doesn't follow those pathways, you have to be curious about why.
Well, that you said that. I mean, I think patients need to get curious.
Yeah.
We have many clients that come to see us because they think they should. Someone told them or their spouse said you need to do it, but they're not curious.
Yeah.
They're just checking the box. And sometimes I'm sure you get patients who were told you need to go see peak performance and they're just checking a box.
Right.
But the level of care goes both directions. If the provider's curious, like it sounds like you just preach and teach, also allowing with that education, like you said, economy of scale, allowing the patient to be curious, people to be curious. Like just because your parents have had degenerative disc issues and now you're starting to show the same symptoms doesn't mean you have to go down the same exact path.
Right.
Yeah. Even though genetics and symptoms look the same and body type looks the same, but there is sometimes a crossroad. There's a fork in the road. Yeah.
Yeah, and decisions and, truly understanding. I think when you talk about patients being curious, one of the things that healthcare does oftentimes is it's so technical that people don't understand it. And when people don't understand it, they become afraid of it.
Yeah.
And you don't know what you don't know, and you don't even know the question to ask when you get in there. And so that's where oftentimes with my patients, I will sit down and write down, you're going into your doctor, this is what I want you to ask. And not just like what I want you to ask, but this is why. And if they say this, then I want you to ask this. Because if you don't know where to start, it's intimidating.
It's sure
You
is.
need somebody to help you through the process. Like, if you sat down right now with an attorney and they're using all this jargon and all this, you're like, wait a minute, like, what are you talking about?
Yeah.
Where do I start? Like,
Yeah.
what, like.
Yeah, actually, I met with one. We're trying to do our trust with our family and kids and all that. And he did a nice job, but it was like still overwhelming. And then you're like, I'm paralyzed.
Right,
I'm going to
yeah.
wait another 3 months and fill out this
And
thing.
then what?
And
Yeah,
then what? And then,
yeah.
then we started over again. So, yeah, afraid of the system creates a lack of curiosity. That's a good way to put
Yeah.
it. So chiropractors, sports medicine doctors, personal trainers, nutritionists, massage therapy, where do you see all this fitting together? I think you've heard my dad talk about it a lot, and his vision's always been so big of where it could go. Do you think there will ever be a time and a place where you can kind of walk in and get preventative care, but also have all these different specialties and areas of expertise in one building,
In one place and
or one network, or am I just kind of dreaming? But like chiropractors, when people think of chiropractors, they think of the spine, but they may connect a physical therapist and a chiropractor. Like, do they do the same thing? What do you think about all these different modalities and
disciplines
Yeah.
and like where we're going with that? And I think it's absolutely necessary for collaboration in healthcare to happen. When everybody's gotten so siloed and so, siloed in their discipline,
yeah?
that the collaboration and the communication,
Specialties and
right? And
specialists.
that's great and that's fabulous. But at the end of the day, you have to realize, like, they walk in with all their parts and they walk out with all their parts. So when somebody comes in to see me, they don't come in with a shoulder problem. And that's oftentimes how they're treated in healthcare. Like, I've had patients that have come in and that said, I went into the doctor and they said, I need to come back and make another appointment because I have another issue that I want to talk to them about.
Oh wow, yeah,
And so we can't cover that today because I only have 7 minutes with you.
yeah. That's interesting.
But the fact of the matter is that, and even how prescriptions in physical therapy are written, they're written as somebody comes in with a rotator cuff injury, you can only treat their rotator cuff if insurance is particular about that. Well, I fight back on that every single time because somebody doesn't walk in with a rotator cuff injury.
Sure.
They walk in with a full body that needs to be optimized. Why did they tear their rotator cuff? What happened in the process? How did it lead to this? Because if I just treat that rotator cuff to heal,
You're not doing them
chances
the
are
full-
it's going to happen again.
Yeah, you're not doing them the full
and then
justice.
they're back in the system.
I
So-
say that in some of our presentations, like you hurt your rotator cuff or your rotator cuff is bothering your shoulder, but your ankle is out of alignment.
Mm-hmm.
Do you think that has anything potentially up the chain? And people kind of look at me like, I've never thought about that. And like with Ryan, I believe he had pain in his tricep or elbow area. And I think it had more to do with his neck and upper back, not necessarily that one location that maybe a massage therapist would be massaging out. And so I just find it so fascinating, not only the musculoskeletal system, but that fascia, the connective tissue, like all of it's connected to the brain and the gut and all the
Right,
different.
yeah.
And I was reading about the vagus nerve and how a lot of physical therapists are trying to teach their patients on breathing to get them into some different positions that they didn't think were possible because they're so tense and breathing through their mouth or
Right.
too many breaths.
Yeah, and you can stimulate the vagus nerve because you're stimulating your autonomic nervous system. So, your vagus nerve is comes out of your brain. It's one of your cranial nerves. But
Right.
when you're doing diaphragmatic breathing, you have your diaphragm attaches to your autonomic nervous system trunk chain in your thoracic spine. So by stimulating that, you can calm your autonomic nervous system down, which is going to decrease your vagus nerve stimulation with individuals. So there's different connections. And for me, I always want to be careful that you don't go too woo and too like,
Yeah.
your ear's connected to your big toe and,
Yeah.
maybe.
Yeah.
But I really also like to just look at, like, you can track a lot of this through science, through research, through nature. If you
Yeah.
follow nature, like there's some pretty glaring
It's an art and a
signs.
science in a way that I think obviously you have to be in the science, and insurance is going to be so fixated on the science, and then the patient wants to hear the diagnosis, but there is an art to it that
there is.
Sometimes I think you do a nice job of explaining, but also there's sometimes you can't explain it. Mm-hmm. It's just you've done it for how long have you been doing this? For 25, 30?
26 years,
30 years. My father's been doing it 40 years. Like, it's just something you kind of know, and it's an art to it just based on how people talk and they behave and their belief.
Yeah.
I see a lot of people, and it's something that I work really hard on, is my neck. Mm-hmm. With texting and typing and sitting here in this podcast position with this chair, which I got to get close to the mic so I'm not in that
like upright posture.
Yeah, and how many neck issues are you seeing that could be not where it stems, but where they're showing symptoms? And how many people out there don't even realize that they're setting themselves up for tremendous pain and discomfort in the future because of what they're doing to their neck?
Their posture, yeah. We see that a lot. And posture, believe it or not, they consider sitting as one of the worst. One of the worst things that anybody can do. And how often are we sitting throughout the day? So they're putting it up there as an epidemic in our society right now in regards to sitting. But sitting is bringing everything forward, right? Shoulders forward, head forward, hands forward. You're in this forward position as opposed to elevation where your breastbone is up, your shoulders are back, your neck is long, like all of those type of things. And so when I start to see neck injuries or irritation or disc pathology, I look at the whole system, because when you start to come forward in your posture, what happens is you change the angle of your shoulder, so you increase risk of impingement. And as you drop forward, your eyes stay on the horizontal.
Sure.
So your neck actually extends. And so when you extend or look up, to keep your eyes on the horizontal because your shoulders are forward, you have increased impingement of your nerves where it comes out of your neck. So it can refer down your arm. So all these things can be symptoms. And so people will come in and they'll say, I have impingement and my shoulder's sore and I get achiness in my neck and I don't feel like I can get a deep breath. I feel like I'm out of shape. Huh. That's all from postural things that you can start working by opening up, gaining posture, and just by changing a few things of if you put your hand on your breastbone and lift your breastbone up, that's the only cue that you have to give, because now that sets your shoulder blades, right? Not push your shoulders back. Right. Don't shove your shoulder blades together, but lift with your breastbone. You do that, now your eyes come down to be on the horizontal. Your shoulder blades sit back where they should. You maintain a neutral kyphosis or curve of your thoracic spine, and you're sitting over the top of your pelvis. So those are the simple cues that you can fix a lot of things just by a little cue, by not saying, okay, do this with your neck and this with your shoulder and this with your hand.
But you're just conscious of it and paying attention to, if you are sitting a lot, just to move in that space, right?
Yeah.
No space is bad unless it's just repetitive, I'm sure.
Yeah. Yeah.
What could somebody do to really bulletproof their neck and their posture and their spine? What's something you wish more people did on a regular basis when it comes to that neck? Obviously, when we say sitting, obviously people are texting.
on the,
Yeah, because when I'm sitting, my head's, it's not a great position.
Right,
when I'm texting, it's worse.
Right, yeah.
So it's just accelerating. What do you think more people should do when it comes to the posture and the neck?
Yeah, so there's something, when we look at stability, stability of your neck is one of the most important things. When your head is forward, you're actually taking the muscles from your neck. So think about this. When you're training your bicep, so everybody knows what a bicep curl is. You're bringing your hand to your shoulder, sure, right? When you do that, you're contracting your bicep, but in order to move your elbow, your tricep, the muscle that does the opposite action of that, has to turn off. So your tricep is not firing, right? So same thing with your neck. As you're looking down, you're gaining flexibility, you're gaining that contractile of your scalenes, of your deep cervical flexors of your neck. But what's happening when you're doing that is the muscles that directly attach to your spine are turning off to be into that movement. So we have so many people that are coming in that have muscles in their spine that attach directly to their neck that are so weak that in an MRI you'll actually see adipose tissue infiltrating into the muscle. So fatty tissue into the muscle.
Is that kind of that
because
round,
they're so weak.
That little ball on the top of people's
Potentially, some people will get that kind of that kyphotic curve, but right in the muscle, you can see fatty tissue in the muscle. So what you need to do is you need to maintain your posture, but then start strengthening what are called your little multifidus, semispinalis. They're tiny muscles, but they are your stabilizers of your neck. It starts with that. And so simple thing that you can do is just sitting up and you put your hands on the back of your neck and keeping in that posture. As you bend forward, you're going to start to feel those muscles. If you're not bending your chin down, if you just bend forward at your hips in that position, you will start to feel the muscles in the back of your neck engage.
I feel that.
That's where you start to facilitate that, your multifidus. So that's the first thing that you need to do is you need to find those muscles. You need to get them to activate. And then once you get coordination of them, then you can start doing resisted training. But so many people, the muscles don't even, when they do that, they don't even feel them firing.
Well, when I came to see you, mine weren't firing in, my back. And
yeah.
And I feel pretty aware, but it is hard to find that.
And when you have injury, oftentimes that it causes inhibition of the muscle. So when you have injury, your body, your neurological system will say, don't fire, we're in danger. Because if you fire, it's going to cause more pain. So the longer that you're in pain or that you have injury, oftentimes you're getting neurological inhibition of the muscle. So you have to work through that.
So I asked this and I'll ask it again. I know you have like massage therapists in your practice and personal trainers in your practice, and it sounds like so much more involved with the nutrition aspect. It sounds like you're really trying to be a one-stop area for people in this space. Is that true?
Yeah, when you talked about like the collaboration, like that is one of our core values is collaboration. Collaboration with our community, collaboration with our physicians, collaboration, interdisciplinary collaboration. So yeah, we have, a chiropractor in our Lansing office.
Oh, really?
We have massage therapists. We have personal trainers. We have individuals that do dry needling, that do blood flow restriction, like all of that. And then we collaborate closely with our community providers. So you guys from a nutrition standpoint, orthopedic surgeons, integrative cardiologists, we're massage therapists. We're looking at how do we optimize this person? What do they need an EMG? How can we get them in to see those type of, and so when you say, is there going to be a place, that one-stop shop of where people can go? I think that's where we're heading as we're starting to see concierge medicine, as people are starting to understand the value of healthcare because insurances are paying less. So people are starting to pay more. So they're feeling the exchange. When you're feeling the exchange and understanding the cost, would you, if you hired somebody at your house for 7 minutes and said, I'm going to pay you $250 for 7 minutes, what would your expectations be?
Right. Yeah.
And so when you're starting to look at those kind of things, that's what's going to drive the collaboration and the market to increase the overall health of our population.
Well, I love it. And I'm listening to a podcast, founder of Ritz-Carlton, about the experience. And I think you believe this because I've known you for forever, and not just having another facility or just another thing to check the box, but the experience around healthcare. I do think sometimes we look at healthcare like healthcare, when you could look at it like the Ritz-Carlton in a sense of what does it feel like when they come in? Are they greeted the right way? The forms and how they get to fill those out. And I'm sure you look at all of those things. I do as I'm curious about a better experience. And I think that will be, to me, the future of this is people experience such a great thing that they refer it and then they talk about it and then it becomes normal, because once upon a time nobody had a personal trainer. Right. But at some point someone had a great experience and then you refer it word of mouth, and then now everyone knows what personal training is. Yeah. And I think, not to bash personal training, I think they have an opportunity now to take the next level, because I don't think anyone needs to have their reps counted. I don't think. Right. I don't think the lack of.
Well, there's AI now.
There's AI. Yeah. Programming.
And when what you're talking about here is exactly what is going to make or break. I feel, as a CEO of our company, is going to make or break companies in the next 3 to 5 years is the experience, because AI can do so much, but it can't provide the experience. It can't provide those moments that people remember, that people cherish, that people are really, the memories. There's a lot of things that happen, but what are the moments that you remember? And that's in healthcare. If you can get to the point that you're doing that, that's nothing that AI can replicate. Right? AI, I mean, they have robots right now that give some of the best massages out there.
I've seen them. Yeah.
It's tremendous, right? I mean, so when you're looking at those kind of things and where AI is going, we have to be innovative enough and futuristically thinking of how can we provide the optimal experience when somebody walks in the door, because that's gonna differentiate you between a robot and human.
Okay, so then the question is, how much work is that for you to think that way? I mean, it's a lot more work.
It's a lot of work.
Yeah.
It's a ton of work.
And changing procedures and policies and training and development and hiring and firing and
yeah, and we look at, and I say this all the time, is that, as we look to revolutionize the way that rehab is delivered, is that we want to automate the ordinary and humanize the extraordinary. Like, that's what I talk to my team about all the time. If we can automate it, we want to do that. We want it to be simple and seamless and easy for patients and community members that are walking through our doors. But we want the experience to be so great that they're remembering those moments forever, right? Where they're like, what was the highlight of your year last year? It was actually going to rehab.
Yeah, I'm telling you. And I texted him before you came in and just said, hey, I'll tell Jill you said hi, because that was profound to me, because not only did you get him back to where he could compete, he felt like he probably was competing better than he was before, like you said with your story.
Right.
And that's, I don't know, that's a pretty powerful emotion, and it's a pretty powerful connector.
Right, yeah.
Yeah, and I'm a big fan of it. So as we kind of end this in the next 15-ish minutes, let's talk about nutrition, the space that we love, and you've collaborated with us so much. And where is nutrition going to fall in this physical therapy ecosystem?
I think it's really interesting. And, we talk about collaboration all the time. And I think it still needs to be highly collaborative with specialists like yourself. Because if you look in medical education and physical therapy education, we go to school for a long time.
Yeah, you do.
But we have very little education in our didactic studies that are highlighting nutrition. And it is so important. Like, you talk about it all the time, and it's your space, and it's your expertise, and it's what you bring to the table. No physical therapist graduating from school is going to have the knowledge that you have right now.
Right.
Now, not that they can't get there and get continue their education and get their nutrition certification and continue to be curious and study and, the things that I've done and that we do.
Do they want to do another 7 years of nutrition studies, right?
Right,
To get a paycheck.
Right. And so that's where I think it's really important to be highly collaborative and highly curious in our field and in the medical field as well. I mean, they'll tell you, the best of the best will tell you, I don't know that much about that. But I do know a lot about what medication to give, because that's what we learned in school. But so when you get to the point that you can be highly collaborative in your field to say, you know what, I don't know a lot about that. Can you help me? That's when you're sitting there with somebody that knows what they're doing.
Yeah, that's that curiosity. Yeah, I mean...
And the vulnerability to say, I don't know, I need help.
My wife will ask me, why are you going to physical therapy? Because I feel so much better. I don't have the expertise on the manipulation. That's not my expertise. I haven't spent 15 plus years with thousands of patients with all these different nuances in that setting. And so,
but I'm sure you thought about it to yourself as you went in, like, I have to be vulnerable a little bit, or this is maybe awkward. Like, I feel like I should know this, or there's some of that component of that that's hard in healthcare, because when you go through training, you're supposed to know that stuff, but you're not trained on it.
Yeah, know it.
Like, then you don't. And if you don't
control
know
your emotions, but no one's showing you how. That's kind of one of the things. Right. It's the same thing.
Yeah. So, I mean, when it comes to nutrition, what we do is, like, I think of physical therapy as the building blocks, but nutrition is the actual equipment. Like that, it's the equipment that allows those blocks to be stacked.
Sure.
We put muscles back together and tendons and, cause tension, strain relationships, that kind of stuff. But if you don't actually have the equipment to be able to do that, you can do that all day long and you're not going to get better.
When did it click for you nutritionally? I mean, you were so curious. I'm sure you've always had it on your radar screen, but when did it click? Did something happen? Did you see the success in a patient, or you just saw the opportunity or the gap? Like what was your click?
It's interesting. We talked earlier at the beginning of this that, I went through college on playing basketball, on a basketball scholarship. Never once did they talk to us in college about what we should be eating, when we should be eating, or any of that.
Yet you're eating 3 times a day. It must be somewhat important, right?
Yeah, I mean, they had training tables and we had food available to us, but nobody sat us down and said, if you do this, this will optimize your performance in college. Now, they do that now a lot more.
Yeah, they do.
And because they've realized that that's tremendous, right? So, but for me, it was, I'd been injured. I was racing mountain bikes and I herniated a disc in my back. And so I needed to be upright in a wedding dress in 2 weeks.
So when was
after
this?
Surgery?
When did you do this?
This was 25 years ago.
Okay.
So, and in that process, I had talked to somebody that said, well, you're not going to heal that quick in 2 weeks because I'm getting married in 2 weeks and I had surgery 2 weeks prior to that. So I had to be in a wedding dress and heels. And they said,
this was your wedding?
My wedding.
Got it.
Yes.
I heard wedding dress, but it didn't register.
Yeah.
Okay.
Yes.
Your wedding.
And so I'm like, I have to walk down the aisle 2 weeks after I have a
serious injury,
surgery on my back. And so they said, you're not going to be able to heal in 2 weeks, just from a tissue healing standpoint. At that point, I knew that. They said, these are some of the things that you can do nutritionally to get you there. You need to start doing it before you have surgery so that you're on the process of way to healing, and then that surgery is going to make, and it made a difference. I literally walked down the aisle in heels. I danced at my wedding. I had a lumbar brace on under my wedding dress, but that was like, wow, this is amazing. This
just
stuff
for what
is
it did
amazing.
with the inflammation and the repair and the...
Yeah, and I wasn't healed at that point. Your
you're not.
tissues don't heal that quick, but I tell you what, it was a game changer.
You got you to where you wanted. Well, what's your thoughts on, you were talking about the brain and the skeletal connection, and we talk about the gut-brain connection, inflammation, and obviously we could spend many more hours of going deep in the nuances, but what are you seeing right now with inflammation at its all-time high? I don't have the stats on it, but it's at its all-time high.
Yeah.
Nutritionally, we know the connection a lot more than we ever did.
Mm-hmm.
And yet most people, I think, probably are coming to see you in an inflammatory state, whether they injure themselves or that's the root cause. How do you help people when you got to structurally get them back, and then you also know that education, but the education takes time and behavior and all that stuff? Like, do you get frustrated with what you know, but how slow or how long
Changing
something
behavior?
takes?
Yeah, no, I'm a behavioralist at heart. Like I love that stuff. But, when I hear you say that, the thing that I go back to, because we use that word inflammation all the time, and there's so much inflammation and so much but the reality of the fact is that inflammation is normal. Good, like inflammation. When you injure yourself, the first phase of healing is inflammatory process.
It's magical, isn't it? Like
it's amazing.
Yeah.
The problem is that nutritionally, we don't have the building blocks, the omega-3s, the omega-6s on board to modulate the inflammation, because the second phase of healing is clearing inflammation, and cytokinins come in to clear and flush. And so when you talk about nutrition being on board, the cod liver oil, the things that you guys do, that's lacking in people's diet. So we don't ever get to phase 2 of healing to where we're flushing. So inflammation's not the bad thing. Like, that is needed.
Pain is not the bad thing, always.
Not always.
Yeah.
Pain's an indicator
Yeah.
that there could be something wrong.
Yeah.
Right? So yeah, looking at inflammation in diet is that we need to get on board those omega-3, those omega-6, because that's where modulation and phase 2 healing happens, where we get people out of the inflammatory process that causes all the other issues in your gut and your tissues and healing.
I'm doing it's a complex nuance in the omega-3s. They're called pro-resolving or specific pro-resolving mediators, and a mediator actually stops the inflammation from happening. And so, clearing it and all those things. So there's these nuances that the body does know how to heal. If you give it that building blocks, or like you said, the equipment to do it. And, the gut, as I think about bone issues, and we have the highest intake of calcium, yet we have the worst bone health, and
Absorption.
yet it's everything to do with your digestive system. Yet somebody might come to see you and they expect you to give them some exercises. And I do see that as an opportunity that you really taken a hold of to try to kind of really evaluate and educate on the whole body, the whole person, not just that shoulder injury.
Right. They don't just walk in with a shoulder.
Here you go. Can you shoot that with something? Can you put a needle in there? And
Right. Yeah. Yeah. And I think that, that you say it really nice, Matt, is I think that's a seamless kind of segue into the fact of when somebody, your digestive system is your gas tank. If you think of it like that, we don't have the Indianapolis 500 cars running around on sludge. Right.
And they're not doing it 24/7 or else it can't.
Right. Yeah. And so I think what you're putting in your body is what you can expect.
Sure.
To really make sure the output, you are what you eat. And I know people say that, but it's really true. Over a certain period of time, that's what's happening at the cellular level.
Yeah, we're on such the same page, and I have all these questions to get to, but I think we'll come back. Is there anything nutritionally that you've just seen? You talked about the omegas, but that you were just seeing tremendous success, even with your high school athletes or professional athletes, or just the older population? Are you seeing it start to catch on? Are you seeing it more and more? Or?
I am, and I'm. We have. By the way that we provide treatment, we kind of facilitate curiosity. And so once we start to get people feeling like that and comfortable and feeling safe to ask or to say they don't know to do that, they start talking about nutrition because it innately comes to, well, what else? What's the next step? What's the next thing? How can I even feel better? Because I'm challenging you to know that you can feel better. And then they start, well, how? Or why, or what's going on. And so it will always lead to nutrition because that's the building blocks of overall health and wellness.
All right, then I'll throw the grenade in what's going on right now. What about peptides? Where are you, how are you staying educated on this, especially in the PT space with BPC 157 and everything that is out there? Where's that going to go?
I don't really know where that's going to go. I think there's opportunity for more learning, for sure, when it comes around that. And I just want to be careful because, you and I have been through this long enough where we've seen the fads.
Things come
and we've seen that, is it a fad or is it a staying power? Is it something?
A tool in your toolbox?
Is it a tool in the toolbox? Is it a building block? Is it, or is it a fad that's being overhyped for one reason or another? Yeah. So, I think there's a lot of value in the conversation.
What are your colleagues saying? Obviously from a business standpoint, it might be a great business opportunity, right, for some of these clinics.
Yeah, and again, I think when you start looking and tapping into nutrition, I'm in private practice sections, I'm in different groups of innovative people, and there's some talk around it, but it's not our wheelhouse, and it needs to be. It needs to be. There needs to be more advocacy around it when we're looking at that. I was just talking with an owner that just brought in a oxygen chamber into the clinic, of looking at how do we get that and how does that interface with peptides and healing and red light therapies and, those kind of things. So, the curiosity's there.
Do you still believe there's I guess I don't want to answer your question, but there's a foundation that people want to jump right over when it comes to even rehab, the basics of blocking and tackling and sequencing?
Yeah, because everything's been so easy. We live in a really easy society. So it's I want results. great, I can get you there. I can get you the results. But it's the from here to the results.
Sure, how fast do you want to do it?
Right, yeah. We can get there, and we can get you there a lot faster than you even think. But what
My
are
dad
you
says it
willing
all
to
the time.
challenge?
If I
what?
can guarantee you 100% results, are you willing to go there? And everyone would say, yeah, but are you willing to do the work?
Yeah, yeah.
And the work,
But it's not necessarily do the work. What are you willing to say no to? That's what I find is the
what
loss.
do you mean by that?
So, what are you willing to say no to fast food?
Oh.
Are you willing to say no to going out to dinner because you need to work out tonight? Are you willing to say no? What are you willing? People they fear more the loss than the gain. And so if you can manage and, block and tackle what they are going to say no to.
I like that philosophy in life is a good buddy of mine said, if it's not a 100% yes, it's a no. And he used the F word, but in our society, it's so easy to say yes. Mm-hmm. We might even be on the fence, or we're texting, we're typing, we think we can multitask, and yet we're missing out because we don't say no to some things.
Yeah.
All right, last thing. Is there anything you want the listeners to know about physical therapy for themselves? I mean, our listeners are all over the country. Obviously, you have Jill has 4 clinics in DeWitt, Michigan, Lansing, Okemos, and Mason. Mm-hmm. But for everybody, what do you want them to know about physical therapy? Where does it fit in their world?
Yeah, so first and foremost is I would challenge everybody to have a physical therapist as part of your healthcare team. Mm-hmm. Your musculoskeletal expert, that's who they are, and oftentimes underlooked as part of the overall healthcare team. It's really
so too.
important.
Yeah, I think
it's part of your team, and you should look to visit them once a year. And I think that is part to optimizing wellness. And then staying curious, understanding what good physical therapy looks like and not good physical therapy, and getting clear on what good healthcare looks like and what not good healthcare looks like, and being the CEO of your body. And part of that is getting with a good physical therapist that can educate you on your musculoskeletal system so that you know the questions to ask and how to direct yourself through that healthcare system, because it's imperative to be successful.
I think physical therapists have to start to come to the forefront of the healthcare system, or as the individual takes a little more accountability. This is such a great resource that for many people, and we've said it and we keep talking about it, think it's only for when I'm injured. It's only for when the doctor prescribes me to go see it for 12 sessions or whatever.
Right, yeah.
Yet that person could evaluate so much more that's going on and direct you in different ways. And it sounds like with direct access, and there's less limitations. There's less reasons to be afraid.
Yeah. And, I guess on my end, I'll end with this, is that always challenge the healthcare system, including your physical therapist, that they are making decisions based on your optimal wellness, not on your insurance coverage. That is critical in our healthcare right now.
Can you say that one more time? Because I think it's that important.
Yeah, so that you are challenging your healthcare team, including your physical therapist, to be making healthcare decisions based on your optimal wellness, not your insurance benefits.
That's a great way to end. One thing I took away and I just loved was sometimes people's structure is normal and their pain is off. And you didn't say this, but I think you also meant it. Sometimes the structure is off and the pain is normal.
Right.
And so I think we all need a coach and a team and different eyeballs, and to prevent some gaps and blind spots. And so thanks for joining me. It sounds like we're going to have to do a 4th session and keep going deeper down this healthcare system. But Jill, thanks for joining us. If you want to see Jill's thought leadership, I think she does a great job on LinkedIn and her website, Peak Performance. And I'm sure there's social medias and emails to get a hold of her. But
right.
Thanks for joining us, and we'll see you again next time.
Thanks so much.